Folks, there's a whole lot of people waiting outside. Obviously, you all got here very early and got in. If you have a sign, we're asking you to please give that sign to me or one of the other staff members, Myron or Kat, if you can walk around. The signs, we don't want signs in here. They block people's view. Somebody can get poked in the eye. So if you have a sign, we're going to take the sign outside. I don't care what the sign says. We want to take it outside. Beyond that, that's
to talk about the issue of healthcare. And we are in what's called the August recess. I'm Congressman Mike Coffman, representing the 6th Congressional District, which is all of Douglas County, all of Delaware County, a good chunk of Arapahoe County, Jefferson County, and all of Delaware County. We are now in the middle of the debate in the Congress of the United States about restructuring healthcare in America. And since we're starting early, I was going to have and there will be somebody later on from the Colorado Hospital Association to give an objective analysis about the bill. And so now you're going to be relying upon me to give my view of it. And so let me kind of walk you through some of the points that I think are very significant, that are in fact the sticking points. And let me tell you, and I'm going to tell you as well, where I see healthcare right now and what reforms I think we can do to improve the system of healthcare in America and of health insurance in America. First of all, let me just say, let me define where I think we are right now. I think we really do have some problems. And I think the President is right in laying out some of those issues. The President has talked about things like pre-existing conditions and how certain folks with health conditions are discriminated against and have difficulty getting insurance. And I think the President ought to be commended about talking about and raising that issue. The President is also, I think, right when he talks about problems in affordability. Problems with small business getting health insurance. I think we have a lot of problems in this country that I think we need to resolve, and we need to move forward with reform. But let me say where I differ. And where I differ is this: that I fundamentally believe that we can accomplish health insurance reform, and I want to define to you in a minute what I think that ought to look like. And I think we can address the issues that the President is talking about that need to be addressed without moving to a public option.
Yeah.
Let's talk a little bit about reform. And then let me tell you when I'm done what I'm going to do. We don't have this other individual since we started early, which I think you're right to start early. What I want to do is, did we get a sign up at all? Did that get done? Where's my staff? Well, I'll tell you what I'm going to do. I'm going to then go, I want to hear what your concerns are, and I want to do it in a balanced way. There is a sign. Well, what I want to do is utilize that sign-up sheet to go pro, con, pro, con, pro, con. So that, and there will be a time limit of no more than 3 minutes. And that is, I think we've got a light here that will talk about that time limit, because what I want is for you all to be able to have, I want to hear as many people as possible. But again, we're going to hear it from a balanced way. And I would ask you to be respectful of each other when we do that. And so let's talk about healthcare in America, and let's talk some about where I think we need to go in terms of reform. First of all, I think one of the problems is that the market isn't really working as it should. And what I mean by that is, if you're a large business, you have an exemption from state regulations under the Employee Retirement Income Security Act of 1974. And so you can purchase your health insurance anywhere across the country where there's greater price competition as you're dealing in a bigger marketplace. But if you're a small business in America, you can't cross state lines to purchase health insurance. You have to stay within your state, limiting the number of providers, limiting competition, and you're paying a higher price. So I think that is one issue. That number one, we ought to let businesses band together for the purchase of health insurance so that they can have the same discounts that large corporations get. And number two, that we need some federal standards to protect people. We need federal standards on protecting people on pre-existing conditions. And not people that are gaming the systems and getting insurance only when they're sick, but people that legitimately need insurance and are being priced out of the market. Insurance is fundamentally about the spreading of risk. And when we allow certain insurance carriers to cherry pick the young and healthy, and to not insure those who have more significant conditions, that have health conditions, we're not spreading risk. And so I think we can do that by establishing some national standards that do that on pre-existing conditions, on portability, and getting out of this patchwork by allowing all businesses to have that ERISA exemption that I mentioned. Tax policy. We need to fundamentally change tax policy related to health care. Right now, if you're an individual purchasing health insurance, there's no deductibility that you have, as a business would have in the purchase of health insurance. So why don't we give that same deductibility to individuals for the purchase of health insurance?
Yes, yes.